Welcome to the Remedies podcast. Woo!
You. Yes, finally we did it. We did it, freaking mamas.
Yeah. So I know your book is called Cavity Free Kids: How to
hmm
Take Care of Your Kids' Teeth from Birth to Teenage Years.
Yeah,
But I
yeah.
want a little bit about you, just so people can get to know you. What got you into pediatric dentistry? How did you? I'm assuming it has to do with your kids as well, but we'll see.
Oh, sure. Yeah, there's the whole story. Shall we start?
Yes, yes.
Okay, well, thank you. Well, good morning, and thank you so much for having me on your podcast. I think this is wonderful that you're disseminating such great information and resources to parents, and especially mothers. And that is one of the reasons why I was so motivated to put out this book, my book, Cavity Free Kids. Just a little bit about myself. I am a board certified pediatric dentist, practicing in Tucson, Arizona. I did my dental school training in Kansas City, Missouri, where I'm from, and did my specialty training residency in San Antonio, Texas, and made my way to Tucson because of a guy. I, I followed my fiance out here to Tucson, who was a practices as an academic neurologist. He's the program director for the University of Arizona School Department of Neurology, College of Medicine Department of Neurology. So he had a long training program as well. So since we were going to be here for a minute, I began my practice. And one reason just to kind of back up into why I went to dentistry, as a young child, I was raised by a single parent, my mother, who really did so much for myself and my two younger sisters, just making sure that she just sacrificed time, working two jobs and still making sure that we got everything we wanted as far as being in all the extracurricular activities, helping us support us so that we would do excel in school, because she just wanted for us to be able to have all the opportunities so we could have a life of financial freedom. So we weren't struggling like it was for us growing up and for her as a single parent. So she kind of told me, you're going to be a doctor when you grow up. So I have that, in my head as I was coming up as a young child. I was going to be a doctor, going to be a doctor. So I actually went to school, undergrad, to become a physician. I wanted to be a sports medicine doctor because of my experience as a figure skater, competitive figure skater growing up. But I tell you, Ethel, I did not want to be a physician. Honestly, it wasn't until after graduation, I got to visit my father, who I didn't really get to grow up with, but he was a dentist and he was practicing in Tehran, Iran. And so it was the first time that I actually got to travel back to Iran since I was born. And I saw him at work. I saw him light up teaching dentistry, light up when he was talking to his patients. And the cool thing about dentistry is truly a combination of the arts and the sciences. You are creating these smiles. You're using a little bit of engineering too, as far as the forces used to align teeth and orthodontics, and how you're going to make the bite fit so that so that patients can function properly and have good nutrition and overall healthy life. And it really starts with your oral health. So that's why I got into, so yeah, so that sparked the interest to go into dentistry. Now I'm getting to, it's a big arc, Ethel. I have a
Yeah,
whole thing to
yeah. Well,
pediatric
I
dentistry.
find it fascinating. I do. I really do.
Oh,
And
thank you.
interesting that you married a neurosurgeon. Like it all kind of ties in. Yeah.
Oh, kind of ties in. Well, in dentistry, you do, of course, rotate through all the different specialties that you can go into. But I knew right away it was going to be pediatrics. I think one of the big reasons is I love kids. Growing up, I am 9 and 10 years my senior of my sisters, so I'm 10 years older. So I was pretty much the paternal sibling, had to take care of them, pick them up from school, take them to dance, all that stuff. And, I was I think, just a nurturer. And I would work in summer camps with kids. And so the dentistry is very different too than what you think of as a general dentist with adults. The pace is very fast because we have a very small window to work in with the kids, right? We got to get
Yes.
in, take care of business, and get out. Um, we also use a lot of medicine in dentistry. Well, everyone in dental, I mean, really, I have to tell people that dentistry is definitely a medical science in that we have to know the patient's health before we go in there and treat their teeth. I mean, it's all correlated, it is all related. But as far as pediatrics, we have to do a lot of sedations at times. And so we have to be aware of all their medical background and medications that we're using so that we can safely administer dentistry for them. So we're not traumatizing this next generation of kids coming up. You know, I think a lot of fear rooted in adults stems from their childhood.
Mm.
So it's no longer that we got to hold down and go. You know, there are ways we can pharmacologically ease their anxiety so that they can have a pleasant dental experience and grow up being great patients and excited about taking care of their teeth. So that's why I went into pediatric dentistry. Becoming a mom cemented it all, but I had already finished. I didn't get married and have kids until after my residency, and it's interesting as I was growing into the specialty, and when I was a resident. And I would talk to parents about, no, you got to brush your kids' teeth before they go to bed. It's like, and they was like, I can't. They fight me. They're running around. I can't get them to brush their teeth. I was like, how can you not brush your kids' teeth? You know, I was being very skeptical and like, and I just didn't understand it until I became a mom. I was like, oh, I get it. It's not so easy. This
Yeah,
little
and
two-year-old,
one is
yeah,
something, then two is two kids running around, and
you
three is
can run.
it's like,
Oh,
oh,
right.
yeah.
Yes, yes, indeed. Yes, indeed. So, yeah, that's it in a nutshell. So, once we came to Tucson, Arizona, and because my husband was doing that combined residency, I we were going to be here a while. I worked in a kind of a group practice the first year, kind of figure out the lay of the land here in Tucson, and then I started my practice in 2003. So it's been over 21 years. Yeah, right? Yeah,
Yeah, yeah,
20 years.
beautiful.
I haven't done the math in a while. Yes.
Oh, wonderful. So how does taking care, so I'm on a soapbox of early, as early as birth, getting
I love
them
that.
into it. I feel you're always parenting, right? From the minute the baby comes out, you're parenting. And so
Mhm.
we love to do sleep training, we love to do baby-led weaning, all these things, but I feel like dentistry or dental care kind of falls to the side, and it's kind of like,
Yeah.
well, they have milk teeth, they're going to lose their teeth anyways.
Oh,
So
yeah.
why, I guess, two questions. What does as early as birth look like in terms of dental care for the child?
Mhm.
And then I lost my train of thought. Yeah, what does it look like in terms of as they grow?
Yeah, no, that's great. And it's so important. The Academy of Pediatric Dentistry and actually the Academy of Pediatrics does recommend that your child be seen by their first birthday. So I really would love to get that out to your audience. If you're taking your child to your dentist, and they may say, oh, we'll see your kid when they're about 3 years old. That really is their preference. It's not that they should not be seen. They really should refer them to a dentist, general or pediatric specialist at their first birthday. But you're right. And that's right. I wanted to express it starts before their first birthday, being seen at the dental office. It happens at home, it happens in the womb. We have to know as mothers that tooth decay is really a transmittable disease. So the bacteria in our mouth does transmit to our babies. So if we can, and there is data, good data that supports this, um, as yourself as a mother to take care of your oral health, reducing the oral bacteria count in your mouth will then eliminate the increased chance of, or reduce the chance of your child having that same high count of bacteria and make them more the potential to have decay because No one's going to tell you not to kiss your baby, right? You're going to just smother them with kisses, but you are transmitting your bacteria onto your baby. So taking good care of your oral health is paramount. Let's start with that. And also, I know when you're pregnant, there's a lot of confusion around when is safe to see the dentist while you're pregnant. You are safe to get dental care up into starting up until your well, in the first trimester, we say wait, but second trimester and third trimester, you are safe to see a dentist.
Okay.
Third trimester gets to be a little bit uncomfortable because of the positioning of the chair. So
Mhm.
really, a sweet spot is second trimester. So get your teeth clean. Make sure if you have any untreated decay, that you are taking care of yourself. One, because of what we just talked about, but secondly, you are not going to have any time after that baby comes to try to arrange time to get yourself to take care. And the worst time to take care of cavity is when you are in pain. So we and that goes in general, like don't wait until you're in pain. Decay starts before you can detect it. We can detect it visually by our oral exam and radiographically with our films. So, so at pregnancy, take care of that. And then as soon as the baby is born, as you're nursing, it's great for you to get in there just with a little a wipey. I love the Spiffies too that was created by a pediatrician here in Tucson. It looks like a little baby wipe for your finger, but it's embedded with xylitol just to swipe the ridges of the upper and lower jaw, the tongue, the cheeks, just some mucosa to get that milk substrate off. Because even our milk, and I nurse, and I failed to mention the most important part of my being as being a mother, right? I had three children. They're older now. I have a daughter who's in college, and my twins, a girl and boy twins, they're
Oh, you
16.
did it.
I, oh my goodness, almost there. It's still so stressful. Stress never ends,
Yeah.
ladies.
Yeah. Yes.
But yeah, so the twins, let me tell you. So I nursed all of them. And when I had the twins, I had one in a football whole position and the other in the cradle and going to town. But you have to wipe it down because our milk also has carbohydrates in it. And so it's the sugar source that the bacteria feeds off that will release the acid. It's the acid is the byproduct that causes the breakdown in the enamel. So I know at newborns, they don't have their teeth yet, but they get them around anywhere between 4 to 6 months. So I do want the infant, the newborn, to be used to you being in their mouth right from day one, just kind of swiping in and out so that they know that's part of the routine. That is why when their first tooth buds, that you move from a finger brush to a toothbrush. So they know that is the routine that we do. And so, and I still want you to help them brushing all the way until they're about 5 to 6. We used to say the parents should assist in brushing until they can tie their shoes, because that would be they would have the manual dexterity to be able to do so. We know now a lot of shoes don't have laces. Velcro. But yes, around that age that they are learning to write and color and using their dexterity a little bit stronger in that sense. So doing that for their first year of life will make that first dental appointment at their first birthday so much better. They're going to be used to having a toothbrush in their mouth, laying down. And I think maybe Ethel, we can talk about later too, like some tips and techniques on how to brush. You know, that alligator that's railing,
Right.
flailing around everywhere. But yes, that's what I wanted to share about up until the first birthday.
And then, so what would you say to the adults who think the milk teeth don't matter? So I feel
Oh,
like,
sorry. Thank you.
yeah, yeah,
Yes,
no, it's
yes,
okay. I just feel like there's a lot of, it doesn't matter, the teeth will fall out anyways. And I know that that has an impact
it
on the
does.
adult teeth. Yeah.
Huge, huge. And that is the number one question I get in my dental practice every day. So the baby teeth matter because, and the baby molars, the teeth in the back that they used to chew, they don't come out until the ages of 10 to 12 years of age. And they are important placeholders in the mouth to allow the adult teeth to come in properly. So if there's a cavity that goes untreated and it grows and grows and grows, one, the decay gets into the nerve and your poor baby has the worst pain ever. You would never want them to have that pain. And then secondly, that leads to infection, and that infection is this inflammation in the body that is chronic and unhealthy and can lead to more systemic issues and also can lead to cellulitis, swelling in the face. If it's an upper tooth, that infection can travel up into their sinuses. And then we're talking about a medical crisis that could really put your baby in the hospital. So the milk teeth, the baby teeth, we call them primary teeth, they need to be taken care of. And that is why it's important to see your dentist at the first birthday. So when we can educate the parents about this, we can give them the tips and strategies on how to make sure that they're getting everything they need, take the films when it's time. And I just wanted to talk just briefly on radiographs. The reason those are important is because it helps us see between the teeth, like where the teeth are touching. You can get cavities on all surfaces of the teeth. It can be on the chewing surface, between the teeth, on the cheek side of the tooth, and on the tongue side. So the only contact that we can't see is between the teeth. So if you look in the mouth and you don't see a hole, and also you won't always see like a small pinpoint cavity visually alone, you have to have our instrument to help detect it. But that cavity can then in between the teeth can go untreated for years to the point where now that cavity is in the nerve. And I don't know if you've seen some kids that maybe have a silver crown on their tooth. That is because the decay was so big, it got into the nerve. We had to do a nerve treatment and place a crown. And a lot of parents like, wow, that seems so extensive. I'm not going to put crowns on my kids' teeth. But it goes back to if you have to take out that infected tooth, then the teeth kind of collapse down and you block the new tooth from coming in properly. And then you're looking at more costly and more complicated treatment later to upright that tooth and allow the new one to come in.
Beautiful, beautiful. The other thing I always tell people, or I don't, yeah, whoever listens to me really, enough with the Cheerios and the Cheez-Its and the goldfish crackers. And it's just, I guess I should segue properly, right? And say, what foods do you like to recommend
Oh,
for
I
children?
know.
But it just, a lot of people, and I don't know how recent it was, it came out that goldfish cause more cavities than sugar.
Hmm.
Your kids candy, and I
Yes.
get so like worked up about it when I see a small child with a lollipop or something, and I'm just like, what are you doing?
Me
There's no
too.
reason.
Yes, I silently judge everybody. I'm like, no. I'm like, I wish I say, here's my book, just take my book.
Yeah, yeah.
I do list it in there, and you named the top one. I can always tell who's having those cheeses. And the thing about that, and I won't say the name brand, the
Right.
cheese crackers. Any processed carbs, chips, crackers, cereal puffs, those are processed foods. So let me just break that down a little bit. Carbohydrates are a form of sugars. So the bacteria in our mouth, or what we tell the kids, the sugar bugs in your mouth, they don't discriminate. They eat any type of sugar. They feed off of that sugar. The byproduct is the acid. The acid makes the holes. So when you're having these processed carbs, they're already so broken down just to make them shaped like a square, shaped
Right.
like a ball, all that stuff. That is easier. Get this, it's easier for the bacteria to digest it and more quickly release that acid. Also, because it's so broken down, it sticks. It sticks. You have those cheese crackers. You look and they're still orange on the top of the grooves of the teeth. So that means there's more time for that bacteria to have a picnic in the kid's mouth, just eating away, just eating away. And that acid just is just it lowers the pH in the mouth. Excuse me. It lowers the pH. And so your enamel starts to decalcify, demineralize. And so anything that's going to stick to the teeth like that So let's get into gummies, gummy fruit snacks. That's another no-no. Um, I know a lot of these things are convenient snacks, and that's why they're so readily available. I used to buy the when I when they were little, it was like a big bottle or canister of the puffs, and I would just like pops them out and just go, right, and they're just eating away. Those cereal puffs, they stick in there too. So gummies, gummy fruit snacks, they just stick. And so it's the sucrose syrup in those fruit snacks. Now it's not just fruit snacks, it's anything gummy. So gummy vitamins, they cause cavities. Let me say that again. Gummy vitamins can cause cavities. And I can see it. I can see the staining in the groove from the coloration of the gummy. And I know there's some, is it Hoya? Some, more natural kind of gummies, but it's still the stickiness. It still has the substrate of the sucrose syrup in there. So if you have this large bottle you're trying to get through, or you just have a whole stash of it, please brush afterwards. But the thing about, I do get parents like, well, I brush after. I said, yes, but even the best brushing sometimes, the bristles cannot get all the way down into the very depths of the grooves. And you're always going to leave a little bit in there. I mean, you really have to do a couple brushings to get it thoroughly clean. So those are things. So let me go through my list. Another surprise one for parents. The pouches of the applesauce and the yogurt pouches. I was wondering, why am I seeing from the upper and the anterior upper incisors? And so I'm really, I saw a little kid walking around, sibling sucking on one while their older sibling was being treated. And I got it. That applesauce and yogurt, the pH is very low, and you're sucking on it. So that contact is direct contact behind those front teeth. It's the same process of kind of walking around, nursing on a bottle that's, they're kind of drinking that all day versus having something to drink and putting it down. But that constant contact will start to break down the teeth. So as we move from, the toddler years, we get another spike. Yeah, so the decay spike really happens around toddler years when we have those convenient snacks. Then it plateaus a bit, and then it spikes again around the tween and teen years when they start eating the stuff like the hot, spicy, flaming hot chips, like flaming hot, whatever's on there, Takis, Doritos, Cheetos. They are lacing it. Powdered acid is on those chips that makes it fiery hot. So now you have this perfect recipe of disaster of having the processed carb of the chip with the acid of just the powdered acid on it, acetic acid. Look at the ingredients on the back. And so it's sitting on the teeth longer and the acid is breaking down the teeth. But back to our kids again. So we talked about those. There's so much, but I hate to say it, like you can't have anything because I do get parents like, well, what can I give them? And I will tell you, but also careful about the juice. And oh, this is so important, Ethel. Don't dilute the juice in the sippy cups. I get that. They say, oh, they just get about 2 to 3 ounces and the rest is all water. Well, what you have now done is given your child a more volume of a lower pH um, fluid to drink. It is better that they get their 4 ounces of that juice when they are sitting down eating a meal. And the reason why we want them while they're eating a meal, when you're eating, our saliva flow increases. Our saliva is a natural buffer. So it helps to neutralize the acid challenge from what the kids just was drinking, what they were eating. The saliva, of course, helps wash off the tooth off the surfaces of our teeth. So if you're going to have a acid challenge with the juice, have it while you're eating. But usually, typically, what I see is the sippy cup that's diluted is with them kind of throughout the day. So they go play with the little blocks and they'll come back and take a little sip. And then they go and read a book with mom and go and have a little sip. And so throughout the day, the mouth has never had a chance to rebalance. So that pH has just stayed steady. And it takes 20 minutes for the pH of the mouth to neutralize. So when we were having those kids eating like this hot, spicy foods or sucking on lemons or anything like that, um, it takes 20 minutes before it neutralizes. So if they tell me, oh, but I'm just going to brush my teeth afterwards, you've actually softened the enamel, and then you're brushing it, you're doing more harm.
Hmm.
And yeah, and if anyone likes to get down to the technical part, there is a diagram in the book that shows the pH of certain beverages in the that we can have. It shows at pH of 7 is neutral, right? Water is neutral. You start to lose enamel at around a pH of 5.5. So the lower we go, the more acidic. Juices, sodas, Gatorades, and mom's carbonated waters
Ah.
are acidic. They're like, no, they like just leave so deflated. Um, the pH is much lower. So when you are and it's almost to the same level as a pH of a acid in a battery. So when you're having that, you are decalcifying your enamel. So you need to eat foods and drinks, water and high rich calcium foods to help raise that pH back up.
Beautiful. Yes.
Yeah. Yeah. And you get it, of course, a lollipop, but that's a no-brainer.
Yeah.
I actually say, I'd rather your kid have a chocolate covered strawberry or chocolate in general than any of all that stuff we just listed for a treat, right? The chocolate melts away. It doesn't stick to the teeth. And it goes along with like ice cream. It doesn't stick to your teeth. That's better than having the gummy or the sticky candies or the lollipops or the goldfish crackers.
Yeah, yeah, those are, yeah. And it's just it's I think you touched on it. It's mindless. It's the mindless, always snacking on something, always drinking something. That's where I get, like you have to realize that you're always either contributing to mineralization or demineralization, and so that's kind of what I try to bring awareness to.
Mhm.
What does the ideal dentally conscious family look like? What do they do, or what kind of foods do they eat? Or we touched on what not to eat, but
Yes, we did.
what are
What can
they?
we? Yes, because that's after that, they're like, okay, so now what can we actually? Well, I think that's a great way of posing the question. I know that we all want the best for our children, and sometimes we just need a little guidance on what is good and how we can do things in moderation. Uh, I'll be the first to tell you that yes, my kids had trees, yes, 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 but there are major no-nos. No sodas except for maybe on the weekend, um, uh, and as far as making sure they're brushing, that was like a boundary that we weren't going to cross, right? Like, as tired as they were, I still had to get in there and brush their teeth before they went to bed. So let's talk about what a family can do to consciously, intentionally help guide their children to have a proper, great oral health all their life. Is starting with planning, I would say. Um, Planning for a healthy diet when you're shopping and in the grocery store, looking to find those snacks that would be better for them. You want to look at things such as we talked about dairy. So cheese, if they can, milk, of course. Foods high in magnesium can also remineralize the teeth. They're going to be your leafy vegetables. Um, and as far as if you're going to have a treat, have it at the end of the meal. And making sure we have milk and water with our balanced diet there. And in the morning, with the kids, starting off by brushing, and I get this question too, Ethel, like, should we brush as soon as they wake up or after they brush their teeth? Well, I know my life as a busy working parent, and we're all both working, the kids are going to different schools and all this kind of stuff. I have made it easier for me, like just in any habit, you just make it what works, right? You kind of ease the barrier of entry for habits. So as
Right.
soon as we wake up, that's when we would do the brushing, and then we have a meal. It doesn't hurt to brush afterwards, but I know what we know is we at least want to get that bacteria count from the very beginning down. And as far as the choices with lunch and pack, apples are your go-to nature's defender. It is a natural fibrous brush. It helps to, I always kind of give that little pro tip is send some apple slices in your kid's lunch or to the daycare because it helps to bring out those carbs that are stuck in the teeth. There's some fun videos on YouTube. You can see kids like eating an Oreo cookie and then eating some apples, and you look in the mouth and it will not clean your teeth. It's not going to replace a toothbrush, but at least in the interim, it can help to lift those things up. And then really having healthy snacks, as I was saying, it's not that you can't have the applesauce or yogurt, but have it in the cup where they are sitting down and then eating it. Like you said, the mindless act of kind of just eating and going, that's not beneficial or useful in to help them to stay cavity free. And then for sure at dinner, after dinner, that I would say when we're struggling on brushing our toddlers' teeth, we got to choose our battles at times. And it is so important to at least get in there and brush before they go to bed, because now that you know the science of how the cavities get started with the fact you have to have a tooth, you have bacteria, and you have to have a sugar substrate. So if you're leaving that sugar substrate on the teeth, then again, more time and it takes time for all that to break down. So more time while they're sleeping that can cause a cavity. Yeah, I hope I touched on everything there. I'm just trying to think of just staying in routine. I found that to really reveal itself during the pandemic when we weren't in routine anymore. And
Mm.
that's where that mindless strolling was happening, online schooling was happening. So there was just a bowl of chips and we're just eating, or we were scrolling through social media and just mindless eating. So just getting into the routine of things and really as far as drinks, because I do want to talk about what's healthy on our beverages to drink, and not to say it can only be water or milk, that's important, but the Academy of Pediatrics, their guideline for a safe amount of juice in toddler years is between 4 to 6 ounces. So they really shouldn't
Per
be
day?
having per day. Mhm. Yeah. So that's when I say, well, you're going to have to decide when you want your child or when they want to have their juice. Is it going to be in the morning, lunch, or dinner? And the rest should be water or milk. But yeah, 4 to 6 ounces of juice. So as we get into tween and teen years, when they're drinking this, they tell me they're drinking Gatorade and soda. They don't need to have Gatorade. First of all, they're not running a marathon. There's no need to to replace their electrolytes. Now, if they're in sports and athletics, I get that too, but then I get to go back. I pull it out from my bag. I was like, I was a sports medicine major. I learned in exercise physiology that having water and a banana would replace the same electrolytes as Gatorade that's really high in carb. So, yes, yes, yes. And then I sorry, one last thing. I was just gonna say, if they grow up with this diet, it's not gonna be something hard. It may sound hard for us because that's not how you or I were raised. Like you just had that all the time, and that has almost caused an addiction that you really have to have your soda. That is not the case for your kids. And everything, we just don't want to transfer what we have onto our children. We want the best for our children. We always want better for our children. So I think it's a mindset shift that we need to have, and we need to have that in everything of what was in the past, and this is what I know now. When you know better, you do better. Thank you, Maya Angelou.
Yeah, yeah.
And we want to make sure that we're helping our kids to really grow up to thriving with healthy oral health.
Absolutely. Yeah. I was raised in a lower income family and my mom did the best that she knew. And so there's
Hmm.
no there's no resentment there. I just feel really passionate about this. I think because teeth respond so quickly or relatively quickly that you're putting in good, so you're getting out good. And it's just, yeah. I always tell people when I'm talking to them, my daughter fell at the park and she has a tiny
Oh,
little lesion on her tooth. And when I took her to the dentist, she was like, okay, don't let it turn into a cavity. And I was like, excuse me, ma'am, what does that mean? What do you mean by don't let it turn into a cavity? And she kind of, okay,
yes.
great. and brushed me out. And I was like, oh, wait, there's more to this than
Yeah.
just don't let it turn into a cavity. And so that's where as you said, there's no resentment in my background. I definitely it wasn't as bad, but I did have school lunches. So chocolate milk and
Girl, chocolate
lots of
milk is, oh
processed
yeah.
food.
I, I have chocolate milk too. I know. And I love that you said no resentment and also there's no judgment because
Oh, yeah,
um there are food deserts and we're highly aware of that.
absolutely.
We know that sometimes eating healthy can be more costly. So we just have to be conscious because there are options of when you do have some assistance in getting food to really get your kids uh, it's like your mouth craves certain foods, so they won't want that any longer. They'll want the fruits and the veggies, and so just getting them introduced to that as early as possible, even if it's just an apple, and you don't have anything else healthy, at least you've had that in there.
Right, right. What would you say, what can we look forward to or what to expect in terms of when the teeth start falling out and the new teeth start coming in? Is there a way to, I mean, besides just observing and making sure everything is going all right, to support
Mhm.
that process, or is it just as long
Oh,
as the principles are still in effect,
yeah,
they'll be
yeah.
okay?
And when you were mentioning about your daughter falling, I was thinking of something I wanted to share. The time to find a dentist is not during an emergency, so I'm glad you had a dentist to go to. So establish that dental home by their first birthday.
Right,
Yeah,
yeah,
even if you're like, they don't have a cavity, you really don't know. You can see everything there, so still get them. Don't be fearful about going because you don't think they're going to sit in a chair. We don't expect a 1-year-old to sit in the chair. They're going to be sitting in your lap. They lay down in our lap in the seat. So, what the dentist is looking for when you're coming every 6 months on growth and development. So that's where kind of a specialist in pediatric dentistry who's had 2 to 3 more years additional training after dental school has over general dentists is that we're kind of looking at the growth and development. And also I want to preface too, because we need our general practitioners, our dentists to see kids because just the sheer number of pediatric dentists, there's not enough of us to see all the kids, and we want equitable access to care for everyone. So just see dentists who will see them by first birthday. If they say no, find another dentist.
right, right,
Okay, so growth and development. It's important for us to see how the jaws are growing. Sometimes we're looking to see that they have an interference in their bite, and that means so we want the top teeth, proper bites, the top teeth overlap the lower teeth. If they have an underbite, like a bulldog bite, it's not that we're going to treat it at that time, but we are going to observe it because it tends to be an interference, and that starts to wear down the enamel over time. So we would get them to the orthodontist when their 6-year adult molars come in, and that's a developmental milestone that parents should be aware of. The adult molars, a lot of well, excuse me, they don't realize they have adult teeth at age 6, but those grown-up teeth they come in behind the baby molars. So it's a little sneaky because you have not lost a baby tooth in the back, so they just maybe think that's a new baby tooth erupting into the mouth. But that is an adult molar that comes in at 6. We call them their 6-year molars. And that is when an orthodontist can use those teeth as anchors for the appliance that would be necessary to correct that crossbite. Other things with development, we can see, and it happens around 6 too, when those adult molars are coming in. Some of your listeners may have had experience of what we call hypoplasia, and that is when the tooth comes in mottled brown. The anatomies of the cusp is compromised, is kind of dark, is porous, and there's a lot of factors, and I talk about this in the book as well, that that contribute to the lack of a tissue. So hypo is less than, and plasia is tissue. So hypoplasia of the enamel on these molars happens during development. So it could happen that first year of life because that is when your permanent molars are developing. So anything, it could have been stress at delivery. It could be the baby had frequent ear infections, and it's not the infection that caused the hypoplasia, but it was that body was had a fever. So the body was fighting this infection. And so the elevated temperatures, the fever in the body causes a halt of kind of all systems so that it can focus on getting better, getting the body better. But what happens when that tooth was developing during that time, the enamel develops in layers, layers upon layers, and that kind of just got disrupted. And so we don't see it until the tooth erupts into the mouth, that we kind of have a loss of tissue there. So it can happen from birth, or if you see these brown spots, or brown, yellow, beige spots in the front tooth or the lower tooth, that's very common if the child during their toddler years fell down. So the front teeth develop a little bit later. So if they fell down during a toddler, we'll see it in their incisors. So it's important that we're catching these things so that we can do treatment to protect it. We can put a protective coating on those. If it's in the front and it's maybe just hasn't broke down the tissue too bad, and it's just aesthetics, we could talk about bonding later on. So we're checking how the teeth fit together. We're checking the growth of the jaws, and we're checking on the development of the enamel as well as soft tissue abnormalities and any lesions. I've caught cancerous lesions early on in like teenage years. I've caught, most importantly, most commonly, I should say too, is tonsils and enlarged tonsils. That sparks the conversation of, does your child snore? Does your child have trouble, staying dry through the night? Are they wetting the bed? Are they hard to wake up in the morning? All these are signs of sleep apnea. And so when I see these enlarged tonsils, I'll ask those questions, and I'll say, I would like you to see an ENT, or definitely bring this up to your pediatrician at their next checkup, and let them take a look at those adenoids and do the proper examination and testing to see if they have sleep apnea.
Beautiful. That was the perfect segue to the next question, which was, I'm assuming a good dentist does look at, tonsils,
Mhm.
airway, and at least, refer you
Mhm.
out to the right person. But
Yeah.
you as a mother, when you obviously looked at your children's mouth. So what could you do to support tonsils, or if they had those chronic ear infections, um, nasal? I mean, I'm thinking anything from nose
Oh, right.
bleeding.
Yes, and my son, he had a lot of upper respiratory stuff, so we were always using a nebulizer. But I will say that it's really important to rinse, brush your teeth, after you have anything like that. Inhalers, of course, too, if your child is asthmatic. But to support a humidifier is really, really great. And here in Arizona, in the desert, we always had a humidifier going in there. It just helps to clear the airway so they're breathing better and easier, that flow, making sure they're opening up all the passages. And as far as what I would look for, I was struggling too, just trying to get there and brush your teeth. So let's not get it twisted. Not until I was like in the office and I had an assistant helping me really get in there. But as far as that goes, really lay them down when they're little like that. Don't try. We'll get to it later. I'm sorry.
It's
I'm
okay.
distracted. Let's go back. So, we're checking for lymph nodes as well. I think it'd be a little bit challenging to tell because infants, toddlers, their lymphs are sometimes kind of big anyway, kind of chronically big until they kind of grow into that. So
Mhm.
I would say the best thing, if you can peek in there, you can kind of get a basis of really a baseline of what it looks like in their mouth. When you're brushing, I always say, don't go in blindly, really be able to go in there so you know that your toothbrush is getting where it needs to get along the gum line, going in little circles, remembering all the surfaces of the teeth, the cheek side, biting surface, tongue side, and then floss. Yes, floss. As soon as those teeth come in and they're touching, make sure you're flossing. Even if they're not touching in the back, sometimes we have a lot of spacing. But again, we're building those habits, right? So it's easier to start a habit when they're young and they grow up knowing that's a routine. But as far as anything we can do to reduce the size of their adenoids or tonsils, we can't. We'll just definitely need to get to the doctor so they can evaluate and decide what's the right course of action on that.
I love using a sulca brush on my 3-year-old. Just get
Oh, yeah.
into the pits. I just find it
Perfect.
like the right amount
I
of
do love that too.
yeah.
Yeah. Yeah, and I'm not as far as any floss go, like the floss I get questions about, do I have to use a floss strand or a floss sticks? And I'm like, whatever's convenient. I'd rather be quick and consistent versus really going in there taking 5 minutes one time a month on the flossing. Flossing. Just get in there every night.
And the my toddler also, I have a 1 year old and a 3 year old. They the 1 year old not so much, but she loves the interdental brushes.
Oh,
Like
good.
I call them the mini pipe cleaners. I don't
Yeah, that's
she,
right.
she just
Get
loves
in
it.
there. It's fun. Yeah. And one of the best tools you have in helping them brush is yourself.
Oh
You're
yeah.
their role model. They look up to you. They want to do everything mom is doing. So let them watch you brush your teeth. Sometimes I would have my toothbrush in their bathroom as well. So I would brush and then they would be, oh, and we do want them to build the habit of or the technique of brushing, but we just know that you have to go and assist them afterwards. But I would brush first well, we would brush together. So they would brush while I'm brushing so we could do it. And then I'll say, okay, now mommy's turn. And then get in there. As far as they get older and they want to make the choices, those that special age. Maybe I don't know about your 3-year-old if she was like that when she was younger too. But you have to let them make their decisions, but you got to give them the choices of which decision they choose from.
Correct.
So
Exactly.
it's not
Exactly.
do you want mommy to brush or do you want to brush? It should be, do you want mommy to brush before you brush or you want mommy to help you after you brush? So that's just a way you can switch it out.
And it's easier with my 1 year old when he sees her brushing. Then he's like into it and just,
Oh, perfect.
oh
Oh,
yeah.
yeah. That behavior modeling is a real thing. And a lot of pediatric dental offices, you'll see our office is set up to encourage that. So our chairs, we call it an open bay. So we have like 4 chairs across. It's great for families so that, younger sibling can see older sibling doing it and they're doing great, and sometimes they're crying and scared. Sometimes it's the older sibling having to watch the younger one. But it's that behavior modeling to say, like, okay, they can do it, I can do it too.
Beautiful. I think I would love to know if there are any emerging pediatric trends, like things that excite you as a
Mhm.
professional. And then I would say, yeah, parting words of wisdom. I mean, obviously, go buy my book so we can all learn.
Yeah, the things, what is really, and this is changing the landscape of dentistry. If your kid, let's say, you've done everything you could, you've tried your best with the diet, but your kid has a cavity. One thing I will just say is don't make it seem like it's the end of the world because the minute that we say, oh, there's a little spot, I have parents like, what? Oh my God, oh no. And then the kid is like, oh my God, what is just happening? And that just scares them to death, right? That's like it's the worst sentence ever. So just try to motions in check, we can fix this. So you've done everything, there's a cavity. One thing that has really come about, and it has been researched for over 4 decades overseas in Asia and Europe, is silver diamine fluoride. And so I was going to share about that. So for short, we call it SDF. And it is a way that we can treat teeth, a minimally invasive way of treating teeth, and more so, a way of medically treating teeth. It's just as if you were putting medicine on the tooth. It's an antibacterial. The silver works. Now, silver is a natural occurring element that's antimicrobial. So it kills the bacteria in its tracks. The fluoride helps to remineralize, but it's just a very, very small amount of fluoride. If anyone's opposed to that, it's really trace amount, but really for the remineralization. The silver is the active ingredient. And is helping us not have to put kids under general anesthesia. Those kids who have um, early childhood caries, we used to call it milk bottle decay, baby bottle decay. Um, but you can also get decay too, just all sorts of things that we were talking about, not brushing and cleaning the mouth and all that stuff. But at least this will help buy us time. Now, this sounds like a great miracle thing. Why aren't we doing it on everything? The downside of it is, yes, it leaves a scar on the tooth where the cavity is, like a staining.
Um,
So the silver is what shows up as a little black spot. But in the back, that is something we can do that you don't see it. But I had to learn early on not to make any assumption about what parents would want. And I have to own up to my own biases. I would be scared to kind of bring up that this kid had decay on the forefront teeth, and I didn't think the parent would want them for any social reasons to have the staining. And so then I went in, it was a 3-year-old, and they needed nerve treatment, they needed crowns because the decay had really, well, sorry, on that, I wouldn't have recommended the SDF. They had enough decay that was close to the nerve. It wasn't quite in the nerve, but we would have to put them under, do all this work under anesthesia. And then the mom said, "Oh, but I was referred because I heard you did the silver diamine fluoride." So I learned very early on never to make a judgment. And so I would love for parents to inquire if their dentist hasn't brought that up. Silver diamine fluoride is a great way of just halting the decay. You can later put a white filling restorative material on there to mask it. There's material that are not resin. We call it a glass ionomer that we can go and then cover up that black spot. And the next appointment, sometimes you can do it the same day. You just have to have the right product to do so. So that is what I'm really excited about because it's really changed the face of pediatric dentistry where we were having to put a lot of kids under anesthesia. And there's a research that shows about how it affects the brain development under the age of 3. So we don't want to do that. At the same time, though, we don't want these cavities to travel into the nerve and cause an infection and abscess and threaten the life of your kid. So I'm excited about that. What else? One thing I'm not excited about, but parents are excited about, are those new toothbrushes that like look like a mouth guard that go in the mouth. Have you seen those?
oh no.
I've been getting a lot of those. You'll see. So it's like you put it in and you don't do anything with your hands, and the bristles are activated and
It's
kind of brush.
electric?
It's electric,
Oh boy.
and you just like sit there and you have it in your mouth for, the 2 minutes, and it's supposed to scrub your teeth. It is not effective. It is not recommended by the ADA, American Dental Association, or the FDA. It has not have FDA approval. Until things change, or maybe they've done some more longitudinal, sorry, studies on that, then we can maybe have a different recommendation or endorsement on those products. But I'd rather you old school, use a regular toothbrush. And as far as electric toothbrushes go, just parting words on that. Really, a toddler should use a regular toothbrush. They already are sensitive to the vibrations, especially if they are heightened sensory in their mouth. The electric toothbrush will stimulate the muscles to contract. And that's when you see the teeth, the kids go, "Oh, ow, it tickles," and then they tighten their cheek. And then that deflects the bristles from really getting down in the gums and really massaging the gums as you're brushing. That's why I really just like a small head, soft bristle toothbrush to kind of clean in those circular motions along the gum line. That's most important. Electric toothbrushes, when they are, a little bit older, 6, 7, that is fine. But just got to pay attention on how long they're brushing. The electric toothbrushes are great. They have a timer. But one of the trick questions I asked my kids on when they're using it, I said, "Oh, okay, so on your toothbrush, when you're done, do you turn it off? You turn off the toothbrush?" And they're like, "Yeah." I was like, "Well, actually, it'll stop on its own after 2 minutes. So don't stop it. You got to keep brushing until the 2 minutes are up." Now there's all this high-tech stuff with Bluetooth toothbrushes that
Oh
you can see
gosh,
on
no.
your app and all that. Like, that's great and all. Just get in there. Um, Parents ask about water picks, using that as an adjunct. It's not that it hurts. I just think as the more steps you put in your nighttime routine, when you're tired, and this happens with any habit, right? You'll go to the easier things. So you might skip the floss and just do the water pick. And that's not gonna do as good as a job as
Yeah,
flossing
definitely.
if they're or like, get stuff out of there. But yeah, just old school brush.
I call myself the analog mom in a digital world. I have the sand timer.
Uh,
I'm like, learn them
I'm
off of
so proud
me.
of you. We give out the 2 minute sand timer at our office. We actually do. So, and it's fun for the kids, right? And when mine were little, I remember we went to some amusement park or wherever, and we won, or not, maybe I bought it. I probably bought it because I was like, that's a great timer. But it was a bubble timer and it had the bubbles going and the balls and it was a 2 minute. But the easier thing is we have the 2 minute sand timer. Easy to get off of Amazon. And I don't know at your dental practice if they paint the teeth pink, the kids' teeth pink. We call it disclosing solution. That is a great teaching tool too. I have some pictures in the book that, when you chew it, we used to do it, I don't know, some parents back when we were younger had it in school programs where you're chewing. But it will show up the plaque. It'll disclose where the plaque is. So the best way to do it, you can buy some on Amazon or wherever online, and is first have your kid brush their teeth on their own, then have them chew the tablet, and then it'll show all the areas they missed. And it trains them to say, okay, maybe they're right-handed and they go and they brush the left side, but they're not quite backward, broken wrist angle is kind of hard and they're missing that side. So then they can learn to switch the toothbrush to the opposite hand and brush the opposite side. So I love my tablets, the little red dye tablets. And that's another little pro tip to help out.
Beautiful.
But yes, yeah. No, just I know everyone, there's just so much out there. There are a lot of resources out there. Try to be intentional of where you're getting the information. The Center of Disease Control has that great data there to look up. Of course, your Academy of Pediatric Dentistry has a website for parents as well, and also for our pediatric group at the American Academy of Pediatrics.
Beautiful. All right. Thank you so much. Thank you so
Thank
much
you.
for your time.
Yes.
Yeah.
Oh, yes. And I didn't say the book is available on Amazon and
Yes.
you can learn more on my website is linked now to you can find it on the mommydentist.com or linked on my website at drlailahishaw.com. Thank
Wonderful.
you.
Well, thank you. Thank you.
You're welcome. Thank you. Have a great day.
You too.
I appreciate the invitation.
Yes, thank you.